Let's get to the panel back with us, and they are back on set. We have Rosalind Kanja. She is the co-founder of Rare Disorders Kenya. She's back with us. We have Dr. Elizabeth Onyango. She's back with us. She's from the Ministry of Health, heading the NCD division. We are also now joined by Patricia Karani. Patricia Karani lives with hereditary angioedema, and she also is the founder of the same support group here in the country. She'll tell us more about what it is she's done over the years. Of course, we have Zipporah back with us. Of course, she is part of KEMRI. Research has come out as so crucial in the support of those living this reality. And of course, Dr. Guerre, who is a pediatric neurologist. Thank you guys for being part of this occasion. Now, I had mentioned that some questions have come through even as you listened in on the discussions throughout this morning and into the afternoon. And we have a question here from Joy Luangu, who is asking, what do we do for life-saving, affordable treatment from NHIF? This is somebody who is living with the Steve-Parson syndrome. Dr. Onyango, this is a question you have to handle. It falls under the Ministry of Health.
So what I can tell those living with the rare diseases is, first of all, you have to go to the health facility. Then once you present yourself there, then the healthcare providers, the doctor or the clinician will advise accordingly based on your diagnosis on how to access care and even support. Yes.
Okay, and is what NHIF is giving us support enough for the entry cases of catering for those living with rare diseases?
We know support will never be enough, but it just depends on your cover and the limit to which you're entitled to. So that can be best advised at the health facility, because different facilities also have different limits of cover.
And let me bring in Rosalind on this one, because we've talked about the costs that comes with managing and treating rare disorders, and insurance companies shy away from supporting rare diseases. What works in other countries perhaps that we can borrow here in this country?
You see, in other countries, in the Western countries, they have stronger sort of insurance, like national insurance funds. That way, some of them, or even private ones, some of them, they do cover, even the very expensive drugs, like sometimes SMA. I've seen some people would be covered. Of course, they have an understanding with the manufacturer. But when it comes to here, of course, there's limited resources. So most people are left to their own devices, but to figure it out. And then the challenge that you have, like from what Joy is saying, is that this drug, even if maybe it's available, assuming it's available in the country, it will not be covered by NHIF. There's only so much that she will get, and I know she's been frustrated several times in getting this treatment. So then NHIF needs to relook at some of the ways that they cover some of these treatments. Because at the end of the day, like it's been mentioned, we are still Kenyans and we do deserve this cover. Yes.
Okay, and this points to equity when it comes to the rare disease space. Dr. Guerre, we have had a conversation around SMA, and we met Mama Naila, and she was saying the devastation that she could not afford this life-altering drug for her child before she turned 2. Is there a light at the end of the tunnel for those living with rare diseases in the country, especially when the cost is so exponential?
Well, in the case of SMA as a case study, a number of pharmaceutical companies have come up with access programs to support the individuals who are appropriately diagnosed and in good time to access the medicines, as expensive as they are. The reality, of course, has been indicated by Elizabeth, is there's a limit to what the insurance funds can support, and it's going to need collaboration from all sectors, private, public, to deliver the care that is necessary. There are other aspects of care beyond the definitive treatment, like intensive care support, occupational therapy, which then public and private bodies can come to support.
And speaking about fundraising, this is a reality for most people that are living with rare diseases and their caregivers. Patricia, hereditary angioedema is your reality, and as you said, going into hospital is part and parcel of your life, which means the cost is high. How do you cater for this cost?
Well, to be very honest, Gladys, at times when I am not well, I choose not to go because I don't know where that money will come from. I was there a month ago. I have to go again this month. So at times, patients who have rare diseases, at times, like now I'm an adult, okay? So I choose for myself what is serious, like really serious, like you're at the end, and what is not so serious, you just choose to ignore because you can't always be catering for that kind of cost every month. It's virtually not possible.
Okay, let's contextualize how serious things get. In the case of HAE, how bad does it get?
HAE is caused by a lack of a protein that you have where your body regulates itself in the complement system. So the fact that I have very low of that means I can swell anytime, spontaneously, anywhere. So that in itself is a danger because I can swell even in my larynx. So the worst it can get is my larynx getting blocked off, my food pipe, my air pipe, and eventually death. It has a 30% mortality rate. Yeah, so that's how serious it can get.
And speaking about mortality, this is a reality in your own family, right?
Yes.
Tell us more.
So it's an inherited condition. So I got it from my grandmother, who then passed it on to my father. My father passed it on to 3 children out of 6 in our family. So my grandmother actually died from a swelling back then in the 1970s. So back then, of course, they didn't know what it was. They just used to say that this is the ugonjwa of Shosho. Shosho is, you know, grandmother. This is Shosho's ugonjwa. And you know, I think you'd feel ostracized, so she never used to, you know, speak out about it much. So actually, that took her life.
Even just by looking at her family alone and researching on her family, you might discover this one little problem that they are going through that is actually also a problem in the bigger diseases that are known. So there could be a linkage that within the family, the 3 children who've been affected by this condition, but there is also a common disease that is really nothing people talk about in terms of finding treatment because it's available, but it could be linked to what they are suffering from. So it provides an opportunity of you are researching on a smaller population, but you're also coming up with innovative methods that can help you understand other bigger diseases that could be linked genetically to that particular condition.
And still on patient support, and this is something that I've heard come up over and over again, whether today or discussions I've had before. Let's start with mental health. This is a reality for many of them. The challenges therein, both for the patients and for the caregivers. Patricia, talk about how this is something that you have to face on a daily.
Yeah, actually, the mental health aspect is very critical because I could talk for my case and my family, where I would find myself trying to eliminate everything just to be well. And even though I eliminated everything, I was still not well because there's not even enough knowledge for me to know that there's no cure for this thing. You have to learn to manage it. So it took such a long time and a lot of trauma. You know, there's always that trauma of I might get a throat swelling out of the blue and tomorrow I might not be there, you see? So that really affects your psychic. You know, you're always ready to move to the next life, you see? And that's not something which everybody, you know, you don't wake up thinking, you know, I might die on the road. But when you wake up and you're not well, then you're like, I know how bad this thing can get. So I'm always traumatized and always in fear and anxiety. I think for me to be able to be an advocate, I have had to go so many milestones. For example, I learned that if I stop focusing on myself too much, and first of all learn to accept that this thing is with me, there's nothing much I'll do about it, I need to learn to accept myself. Then I started learning, okay, let me accept myself. Other people might not accept me, but the fundamental thing is I've accepted myself and it is with me. There's no amount of praying and, you know, all those things that people advise you. just accept it is with you. That was the first step I did. Then I decided, okay, it is with me. Can I now learn how to manage it? So I went through a lot of reading and, you know, going through the books, going through the literature and the research, so that I know how can I be able to manage myself, because there are organizations out there with, you know, huge number of patients, and they've learned how to manage. Then the next thing I had to learn is, now, let me add value, because I wouldn't want somebody to go through all this for so long. You know, you're suffering something that you can actually manage, just that you don't have the right knowledge on how to handle yourself. So it has really helped me be able to speak out, because I would never want anybody to have to go through that. You don't need to die from a condition that can be managed with the proper treatment, with the proper diagnosis, with the proper, you know. So that has sort of helped my mental, to be a bit more mentally stable, because back then when I knew nothing, when I was at the mercy of this condition, I didn't know how to control it. It was really a traumatic experience. And you know, you wonder, so why am I alive? I mean, if I sit like this, I get sick. If I turn this way, I'll get sick. So you lose hope.
Yeah.
Yeah. So I think that's why patients, groups, and support groups to me have worked fundamentally. Because I have learned that there are people out there who actually have been able to manage this condition. Back then, I only thought I was alone. I even remember RDK when we started, I used to say, I am one, you know, in Kenya, because I mean, I didn't see anybody else outside my family space was doing or saying anything. But it's very vital to be in a support group. It helps you be able to deal with your mental status. You can speak out and nobody's criticizing you. They feel what you're going through. So if I was to advise other patients out there, please seek groups where you can fit in. And those groups, I assure you, there'll be no criticism, there'll be no ostracizing you, because that really affects your mental.
Now, Zipporah, I was just listening to Patricia and she was saying she has had to learn to translate research. She's a layman, but now she can actually be able to translate. You can imagine the time and the effort that has been put into that to ensure she can be able to be of help to others and even herself. Collaboration, partnerships are very key. As somebody who is in research, can any of these support groups, perhaps who are coming across new research, reach out to somebody like you or people in your space to help them translate this information?
Most definitely, yes. And I think that's partly why we're also working with Rare Disorders Kenya, because we have come to understand that you cannot solve these problems as a scientist. You need those who live with the condition. You need to have an understanding. So for us to create an intervention that works, you also need to know the person who is going to receive this intervention. What space are they in? If you're in an environment where the society is not accepting you, you know, you have a bigger problem to deal with, because you will not only deal with the patient, but you also have to deal with the environment to accept this particular person. So what information can be provided by research to inform those around them so that they're able to handle this? Her case, for example, her family is more or less immersed into the whole problem. But what about the people around them? Do they really know what they go through? Do they have an understanding that if Patricia today had an emergency, what is it they're supposed to do? Do they panic? Do they run away? Do they call an ambulance? So it will provide an opportunity for advocacy, because when information is available, it is easier to translate it to messages that are more understandable at different levels. For the scientists, they'll be looking for, you have come up with a research finding, and this finding is opening another gap to do more research. Now, for somebody else, it will be, this research finding tells us that if you have a patient like Patricia, you need to keep a close watch over her, because if she has this problem, what is it we can do to make sure that she does not end up in a more critical condition? So you create that environment for advocacy. You can't do that if you don't have research, you don't have findings. And again, this translates into sort of policy level. So if you discover that the best way to support people with rare diseases is we need a policy document that guides the healthcare providers that whenever you have this kind of patients visiting your health facilities, please take the following steps. So that information is critical to create an understanding across the different sectors, private sector as well. if they have a patient who needs an emergency and she has no money, how can they help? You know, is there room for them to support, get this person back to life, and then deal with the issues of you know, payments later? Is that opportunity available? So the patient support groups also work, because I believe when you deal with patient support groups, you'll also open avenue to integrate with those who are providing services that are not cheaply available, so they understand your challenges. Best example is you could get into an understanding where you open accounts with certain pharmaceutical or pharmacies for that matter, where you say, when these patients are coming in, as a group, we have agreed that we'll support them to get through these costs. Please, when it's an emergency, allow them to take the treatment and allow them to pay. So there are many ways that you can use that information to sort of support them.
And that's why it's important to have these conversations every other time to ensure we know what's out there and we're able to pursue. When I came across narcolepsy, literally, it is a condition where you can sleep anywhere, anytime. Now you can imagine the risk factors that comes with that. As we talk about patient support, in the workplace, a lot of patients who live these conditions, who are not understood, have to leave their, or rather lose their source of livelihoods. Talk about the reality of this working in the RDK space.
So one of the things that you find common is that the women become the caregivers, and unfortunately, a big number, you find that their spouses leave because of the challenges that come with raising this kind of children, and the mother is left to take care of this child alone, and she doesn't have a job. Well, or if she does, it's, you know, you're not quite there. So, and then you have a scenario where you constantly, like, if I can use Patricia, where you can imagine every so often you need to go seek medical help for one reason or another. Maybe you had a flare, a trigger or something. So you can't quite have, like, you know, 9 to 5. Or even if you have, it is constant disruption. So you need your employer to understand that, you know, you keep taking these offs, which most people would not be able to get. So if you find the burden of care most of the time goes to the mother of the child, and like in my case, I've had to cut back on quite a lot just to be home and be there for my child, because no one else might be able to do it the same way. And with such very specific or delicate medical needs the child needs, you have to be there to address some of these things.
And the risk factor that comes with living with these conditions is what Marianne was talking about, losing job after another because people don't get it. What is wrong with you? Expound on your reality, Patricia.
Well, my reality is that every other Monday I was unwell, because one of the triggers of the swellings is pressure, anxiety. You know, after you've had a long weekend of resting, then you're imagining tomorrow is Monday at work and you have targets. You know, then of course, you know, your body gets anxious. And so every Monday I was unwell, and my boss could not understand why every Monday I'm unwell. So he used to ask, did Patricia have a heavy drinking, you know, weekend? Because every Monday she's not okay. So it had to take me being fully swollen and going to show physically that I'm not well. So first of all, when I'm fully swollen, it's very hard to even maneuver in town. Okay, getting to a mat, you can't, because you'll go scaring everybody. So you can imagine the extent to which you have to convince even an employer that I am not well. And then after the flare goes down, then I look well. So he's like, okay, well, you're really unwell.
Now, Dr. Guerra, we talked about children being the most affected by rare diseases. Interruption in school is also another reality for these young ones, even as they try to catch up with their peers. When they come to you and they have to ask you to write a sick sheet, at some point the school will start wondering, why you? Why you? What more can be done perhaps to help along these children and their caregivers?
So of course the big deal one for us here has been awareness, isn't it? Across, for educationists, for health workers, for policymakers, for patients. But individually, I would like to define care plans. And the care plan really means that we engage with the parent and everybody else who's involved in the care of this child on the various aspects of their lives that need to be solved for. So education being one of them. What extra support, what additional support can you get at school? What off days do you need, and what should the school do? Should you have challenges on particular days? So that needs to be defined, and I would encourage individuals with rare diseases to really define care plans with their health workers so that one document speaks to everyone.
Now,
To add something.
yes.
What he says is very important, especially we have challenges with people who the disease is not obvious. Like you see, like Patricia looks okay.
Yeah.
Yes, until for her case, something happens. In our community, we have those in the morning, they came with high heels to work, and in the afternoon, you can barely even stand. So you need a wheelchair. And then maybe in the morning, you need a wheelchair the next day. And then in the evening, you're good enough to walk. So most people tend to think either it's in your head, you know. So what he's saying is true, that have a care plan that you can be able to share even with the employer. Don't shy away from showing it to other people who matter. That way they understand what's going on, and you know it's something that is actually real. And also, but either way, you know, of course, there'll be times when you can't do that, and you'll be at the mercy of the public opinion.
I see policy speaking into this very well, and let me bring in Elizabeth on this one. It touches on the Ministry of Health, it touches on the Ministry of Labor. Ministry of Health understands the reality and challenges these patients are going through. How can you lobby to ensure these care plans we're talking about are actually documented, you know, and gazetted enough for people to say this is the reality?
Well, that will take a process, but first of all, we have to begin with coming up with a curriculum, as I talked about curriculum, but guidelines on how we can manage these conditions. There are over 7,000 conditions, but we realize most of them have a common etiology genetically, they affect the children, but which guidelines can we come up with so that based on these guidelines we can take our healthcare workers through them so they're able to actually internalize on how they are to manage this and these clients. And we say we want to even strengthen the primary healthcare levels where most of our patients may be fast seek care. So from there, and then they're able to liaise with the schools, the schools where these children come from, even have a workplace policy that sort of entrenches some of the provisions according to the guidelines. But going beyond that, then we can see how we can come with maybe some of the legislations, so that they can be some special I don't want to call it treatment, but we want these people to meaningfully participate in the society or at whatever level, as children, as adolescents, as employees, or wherever they are. So it's going to take a process. It's going to take a lot of lobbying, working closely with the patient-led groups, ensuring that the policies are right and serve the needs of the people with rare conditions, their families and caregivers.
Okay, speaking about sharing your colors, which is what was the theme of these year's celebrations, what exactly does that mean, and what have we done in Kenya to ensure we illuminate the same?
We are in the rare disease space. Everyone's experience is different. There are those who it's a bit easier, for those who are very, very hard. So by sharing those experiences, it addresses the one question sometimes we would get: who are these people? How come we've never seen them? You remember, like when COVID started, who? We've not seen them. So even in our communication, we always ensure that we have real people living with rare diseases. That way, at least someone can see there are people like us. It is not something far out there unknown. So in a way, that helps make it more real, more human. And then so share your colors also means by me sharing my story in a way, I'm also advocating for myself and the people around us. So that's what it means. Yeah.
Okay, and you've been illuminating the city.
Yes, yes, yes. We indeed illuminate GTC, the toll tower in Westlands, and a lot of people have commented and have seen it, and some who know us have sent us that. That is part of the awareness, yes. And people talking about it, even asking our members, go into your social media, talk about it, tell people that is part of the awareness.
Okay, and yes, the rare diseases are rare, but that doesn't mean they don't exist. Clearly, going by what you've seen and heard today, these realities are here with us. And as I'd mentioned in my line of duty, I've met a couple of them, and it's amazing to hear some of the challenges they have to live with on a daily, but they still show up to advocate. By coming out to speak about their reality, we know more about these conditions. So, ladies and gentlemen, as we bring this to a close, I'd like to just hear your parting shot in as far as the milestones that have been made. Yes, there are gaps that are still there, but there is a light at the end of the tunnel. Dr. Guerra, let me start with you.
Well, having had everyone speak, I think there's a policy opportunity to be deliberate about bringing rare diseases to the fore. With the campaigns and the promises for 6,000 bob stipend, I think it would be a great consideration to have individuals with rare diseases to be beneficiaries of the conditional cash transfers. I think there is a policy opportunity for NHIF, for the Ministry of Health, to prioritize universal healthcare access for people with rare diseases. So that essentially are key items for us to move forward with this.
Okay, Zipporah.
Thanks. I think we may have talked a lot, but I'm not sure we say that we need to even define what's rare diseases in Kenya. So we need that starting point. What are we going to classify as rare diseases? We need data to answer to that. But I think importantly is we need to have a healthcare system that allows people with those conditions they've never understood what they suffer from to come out and be seen and heard and listened to, and probably from there it will be easier to document. Of course, going with that then, it will provide an opportunity for a register, and the register will definitely guide in terms of even where should resources be put, because there are different rare diseases that require different support towards that. And of course, for us in the research field, we would love to have an environment where we research across the rare disease challenges. We can research on mental health, we can look at nutritional challenges, we can look at just the caregiver alone as somebody who is needs focus. What is it that they're going through that needs intervention? So we need to hear from that. Before an intervention is created, we must know what the gap is. Then that can answer to the challenges that we are looking at and put resources to that effect. And of course, importantly, is there have to be resources geared towards supporting rare diseases across the sphere, starting from just not just data, but even access to healthcare.
Okay, very well said. Patricia.
I think as a patient advocate, I would really want to emphasize the importance of patients coming out, patients being able to accept their condition. And by talking out, then you will get the help that you need. You will get to be able to accept what you have, and try and look for ways of even you being able to help others. So my point would just be on, please don't hide, please don't be in your cocoon in the house, please come out, speak out. And there'll always be a body like Rare Disease Kenya who are willing to, embrace you and help you through your journey.
Okay, now the Ministry of Health is a big brother here, catering for all our needs. Your parting shot, Dr. Onyango.
Our constitution states that every person has a right to the highest attainable standard of health, and that includes even the person who has a rare condition. And as a Ministry of Health, we are mandated to come up with policies that address the challenges faced by persons living with a rare condition. And so we shall strive to live to that, to ensure that we come up with the right policies, we build the capacity across the health facility levels, and so that patients and clients are able to access quality services and none suffers financial catastrophe as a result of that, in the spirit of universal healthcare, of leaving no one behind. And we shall also collaborate with different sectors and different organizations, Rare Disorders Kenya, and even other groups to ensure that rare diseases in Kenya is given the priority that it deserves. Thank you.
That's good news. Well, Rosaline, you are one of our hosts today, spearheading Rare Disorders Kenya. Your parting shot.
So for me, my parting shot will be in different categories. So for the public, be kind and be compassionate. For people who, even anyone living with a chronic illness, don't be too quick to judge. Try and seek to understand before putting people aside or labeling them in that case. That way, that speaks to the stigma and discrimination that most members kind of go through. And then to the health professionals, to have interest, as Dr. Guer said,
Yes.
and just to realize, just because there are no treatments, as we say, 5%, out of the 6,000 or rather 6 to 7,000 rare diseases, only 5% have treatments, does not mean no management. They still can be managed, however, and management is also into the health, mental health. It's beyond just giving drugs and all that. And then to the research group, please come. We have a lot of work to do. We are willing and ready to work with you. And we thank Dr. Zipporah and her team, who have been instrumental in a lot of ways. And then, yeah, in a nutshell, that's it. And also to the manufacturers of drugs, we have people living with rare diseases here.
Yeah.
So you find sometimes some of these drugs are offered in other regions and are not offered here. And so we would like our members to also benefit from that. And finally, for those people living with rare diseases, to just know there's a home for you. There are people you can talk to and you can get in contact with. Reach out and we'll be able to walk this journey together.
Very well said. Rosaline Kanja, co-founder, Rare Disorders Kenya; Dr. Elizabeth Onyango, Public Health Specialist, Head Division of NCD Prevention and Control at the Ministry of Health; Patricia Karani, Living with Hereditary Angioedema, founder and CEO, Hereditary Angioedema Kenya Foundation. And you've done a good job hanging on there and doing this for other people. We celebrate you. Cynthia Oloch, who had joined us earlier, founder and board member, Primary Immunodeficiency Association, Kenya, PITS Kenya; Dr. Zipporah Bukania, yes, Deputy Director, Kenya Medical Research Institute, that is KEMRI, also in charge of the Center for Public Health Research. We appreciate your time and definitely a lot of insights into the RD space. We need more people like you on this platform. And of course, Dr. Guer, who has great interest in the rare disorders space. We really appreciate you. It is because of medics like you, we get to understand these conditions and definitely see how best we can support this living this reality. Thank you all for being part of this conversation. Before I bid you farewell, we would like to actually give a vote of thanks, and Rosaline Kanja will be doing that because there are many partners that came together to realize this Rare Disease Day celebrations on this 26th day of February here in Kenya. And I believe this is your camera that you can speak to to those that you'd like to thank.
So the rare disease community would like to thank a lot of people who are players in this and putting this together. First of all, to the Rare Disease Day organization that has been able to bring a unified communication message that we can use to, pull resources from. And we thank you for that and making our job easier. We'd like to thank Adrian Fisher for believing on us, as in he's the one guy who's walked with us the long journey. And we'd like to say thank you, and the rare disease community thanks you for all you do. I'd like to thank Roche Pharmaceuticals for, again, also just making all these projects possible, because we can't do this without the resources that are needed, and then even giving us the information that we need. We also like to thank NCD Alliance of Kenya for allowing us to amplify our voice in the bigger NCD community. And thank you for your support and also making a lot of things happen. Baraza Lab for this venue that you gave and an opportunity to be able to speak from this platform. And finally, Eurodis for being a champion of rare diseases globally in the Europe, and also just assisting us in being able to provide communication avenues in different ways. So from the rare disease community, we thank you. And also beyond that, to also our volunteers, family and friends who have been able to make this a possibility. We say thank you from the bottom of our hearts.
All right. Clearly, you can see there's a big fraternity that made this day a success, and of course, that walks with the Rare Disease Kenya fraternity. We thank you. Rare Disease Day has been marked here in Kenya, and it's been done so well with such great information, and of course, a lot more patients coming out to join us, and also learning about the importance of empowerment and advocacy. So let's hang on to these lessons we've learned, and of course, let's keep pushing the rare disease agenda as we learn more about the same and see how best we can support those living this reality. Have a wonderful rest of this weekend, and again, thank you for joining us.